Addressing education and care gaps in tracheostomy management, insights from a multi-stakeholder global survey. That's what I'm going to talk about today. Again, this is a survey that came from the Global Tracheostomy Collaborative a few weeks ago, and it's quite a long survey, and I'm going to address section by section of the survey. And by the way, my name is Patrick Hutzel from intensivecareathome.com. So in the last block, we were focusing on the suctioning, tracheostomy suctioning and tube changes. And today I'm talking about barriers to tracheostomy care, insights into education, competency, teamwork, and patient empowerment. And I will also link to previous videos that I've made about this survey. So go and check out the written version of this blog if you want to check out what else is in the survey. So, barriers to tracheostomy care, insights into education, competency, teamwork, and patient empowerment. The barriers to tracheostomy care, education, staff competency, teamwork, and patient empowerment were categorized by professional roles and stakeholders, highlighting diverse perspectives and challenges. Barriers to tracheostomy care. The most frequently reported barrier was not regularly caring for those with tracheostomy, and that is with speech-language pathologists, nurses, reporting the largest proportions. And that's where we have the solution here at intensivecareathome.com, because we exclusively work with critical care trained nurses that have a minimum of 2 years critical care nursing experience, right? The survey doesn't talk about a lot of solutions, whereas I believe we have all the solutions here at intensivecareathome.com. The survey continues. Other significant barriers included fear of caring for those with tracheostomy, with respiratory therapists and speech-language pathologists reporting the highest percentages in tracheostomy care being labor-intensive, predominantly noted by speech-language pathologists. That's interesting. I mean, any respiratory therapist, ICU nurse would know that tracheostomy care is extremely labor-intensive, which is why we at intensivecareathome.com exclusively provide services with critical care trained nurses with a minimum of 2 years critical care nursing experience. And the reality is, we also provide evidence-based care. At no point in time is this survey referring to evidence-based care, right? We are the only organization in this industry that brings actually standards into the community. So when you look up on our website, the mechanical home ventilation guidelines at intensivecareathome.com, you will find that the evidence base is that exclusively critical care nurses with a minimum of 2 years critical care nursing experience are safe to look after tracheostomy and ventilation in the community. That is the gold standard, and that is what we are providing here at intensivecareathome.com. So let's continue with the survey. Education and staff competency. A lack of optimal educational resources or not using the latest delivery methods was a key challenge reported most by speech-language pathologists and nurses. The limited availability of simulation case scenarios for emergency trainings was a concern, as reported by respiratory therapists in the US and nurses. Additionally, onboarding healthcare professionals being time-consuming and the lack of standardized curriculum on tracheostomy care were frequently cited by respiratory therapists and speech-language pathologists. And I'm not surprised, because, nurses would know that there needs to be a unified approach, and nurses would also know that there needs to be evidence-based care. Once again, that is what we are providing here at intensivecareathome.com. Furthermore, 27 respondents provided comments outlining other barriers to training and retaining skilled healthcare professionals in tracheostomy care. These included the lack of available healthcare practitioners, staff shortages, and limited interests in achieving excellence in tracheostomy care. And I couldn't agree more with that, there's not enough healthcare practitioners, i.e. nurses. Well, I will say this, and yes, I'm tooting my own horn here. We have a below industry average staff turnover, because I believe we are providing quality care for tracheostomy clients in the community. Again, from that end, I do believe the survey lacks depth and solutions, whereas, I'm a critical care nurse by background, and we've thought well in advance about what intensive care at home needs to deliver for clients with tracheostomy and ventilation. And once again, like I said, we provide evidence-based care, and we provide standards in the community. The survey continues. Some respondents highlighted misconceptions that tracheostomy care is solely the responsibility of specialists, fostering a not my issue attitude among routine ward staff. Certainly the case in my experience. And I've worked in ICU for over 20 years, in hospitals. And I've also worked with intensive care at home for a long time, for more than a decade, in different countries. Other barriers included the lack of skilled specialists, inadequate bedside staff, and restrictions preventing student nurses from performing tracheostomy care due to perceived risks. Resistance among healthcare practitioners to use one-way speaking valves with ventilated patients was also noted. Again, this is where specialist skills come in. You need to know when you can use a one-way speaking valve as opposed to not to. Again, this is why critical care nurses are the bread and butter when it comes to tracheostomy care, whether it's in a hospital or outside of a hospital. Additional challenges centered around insufficient funding and resources for staffing, low wages, high costs of training materials, inadequate reimbursement policies, limited time allocated for staff and patient training, insufficient time for care coordination, and the extensive time investment required for effective provider training. Further barriers included the lack of personalized training programs for families, early patient discharge from acute care settings, insufficient post-acute care resources, and a general lack of awareness regarding knowledge gaps in tracheostomy care. Of course, insufficient funding is a perception, right? Intensive care at home would not be operating if there was no funding for critical care nurses in the community. So a lot of it comes down to the advocacy. And given that, the Global Tracheostomy Collaborative doesn't seem to have a gold standard like we do, or evidence-based standard, this is all just a whole lot of waffling without providing real-world solutions, which once again, we have at intensivecareathome.com. Low wages, once again, we pay our staff, I believe, a very competitive salary. And again, that comes down to our advocacy for our clients to get a critical care nurse funded, because once again, that is evidence-based. Limited time allocated for staff and patient training. Again, we have allocated time to training for our staff. Further barriers included the lack of personalized training programs. Again, we have a solution for that as well, because we always train our staff in a personalized way, right? So that the clients and families are happy with the tailor-made solution that we're always offering. And also, obviously, a general lack of awareness regarding knowledge gaps in tracheostomy care is real, because once again, when patients leave ICU, which they shouldn't when they have a tracheostomy or a ventilator, right, who's going to look after them safely? Once again, that's where intensivecareathome.com comes in. We can look after clients at home and in the community very safely. So with Intensive Care at Home, we are currently sending our ICU and critical care nurses into the home 24 hours a day. We are providing the following: home care services for ventilated adults and children with tracheostomies with critical care nurses 24 hours a day. A genuine alternative to a long-term stay in intensive care or long-term acute care. We're providing tracheostomy care, home care services for patients on non-invasive ventilation, such as home BiPAP, home CPAP. We're providing services for home TPN, also known as total parenteral nutrition, which is also known as IV nutrition. Also, home IV potassium and home IV magnesium infusions, IV fluids and IV antibiotics. We're providing central line management, peak line management, Hickman's line management, as well as port management at home. We're providing nasogastric tube and PEG tube management at home, cough assist machines for our clients for airway clearance at home, palliative care services at home, as well as ventilator weaning at home. We're also sending our critical care nurses into the home for emergency department bypass services. We have done so successfully as part of the Western Sydney Local Area Health District, their In Touch program, saving approximately $2,000 per patient that we keep at home instead of them going to an emergency department. That also means we're in a position to cut the cost of an intensive care bed by around 50%. An intensive care bed costs between $5,000 to $6,000 per bed day. Our service costs between $2,500 to $3,000 per bed day. And we're freeing up the most sought after bed in the hospital, which is the ICU bed. Most importantly, we're improving the quality of life for patients and their families, which is a win-win situation for all stakeholders. Of course, quality of life is much improved surrounded by families instead of staying in an intensive care unit. With intensive care at home, we're currently operating all around Australia in all major capital cities, as well as in all regional and rural areas. We are an NDIS approved service provider all around Australia, TAC and WorkSafe in Victoria, DVA, Department of Veteran Affairs, all around Australia. Our clients and we as a service provider have also received funding through public hospitals, private health funds, as well as departments of health. We are currently the only service provider in Australia that has achieved third-party accreditation for intensive care at home nursing in 2025. We have been achieving this level of accreditation since 2012. No other provider in Australia has created more intellectual property when it comes to intensive care at home nursing than we have. This puts us in a position to employ hundreds of years of critical care nursing experience combined in the community. No other service provider in 2025 employs a higher skill level in the community than we do, which enables us to look after the highest acuity adults and children in the community in Australia safely. If you are at home already and you're watching this, or you're stuck in an ICU, or if you're going to hospital and ED all the time and you realize that you don't have the right level of support at home, or if you're living in an ICU, I'll give you a very tangible and real-world example today. One of our first clients, when we first got started in 2012, was a client who was at home initially on a ventilator with a tracheostomy with a support worker model 24/7. Of course, support workers are not equipped to look after a ventilated and tracheostomy client. That is dangerous and it's negligent. Having support workers looking after a client at home on a ventilator with a tracheostomy is like flying the airplane with a cabin crew instead of the pilot, because anyone on a ventilator with a tracheostomy is at very high risk of medical emergencies 24/7, or even at risk of dying if they don't have a team of critical care nurses looking after them 24/7 at home. This is actually evidence-based and is documented in our mechanical home ventilation guidelines that you can find on our website at intensivecareathome.com. Think about it, in an intensive care unit in a hospital, you wouldn't have support workers looking after your critically ill loved one or after any critically ill patient on a ventilator with a tracheostomy. So why would anyone in their right mind would do that in a home care environment in the community? So this client found out about us eventually, and the ICU that he went back to all the time also knew about us and eventually reached out to us, and we were proving our concept with this client very fast. When we worked with this particular client, we sent him intensive care nurses 24 hours a day, and he never ever went back into ICU ever again, as long as we were working with this client. We can do the same for you if you're not safe at home, and help you with keeping you at home predictably. Otherwise, we wouldn't be in business. The same is applicable for those stuck in an ICU, similar to this case study that I've given you. Or if you're going back to ED all the time, please reach out to us. We can help you with taking you through the right steps, including how to get funding with different funding bodies. This is also why we are providing level 2 and level 3 NDI support coordination. We have a team of NDI support coordinators, and they have a wealth of knowledge. I've done an interview with Amanda Richards, one of our NDI support coordinators, and I'll put a link to an interview with Amanda in the written version of this blog. We're also providing TAC case management in Victoria. If you're an NDI support coordinator or a case manager from another organization watching this and you're looking for nursing care for your participants, please reach out to us as well. And if you need more evidence for nursing care, we're also writing nursing assessment, NDIS nursing assessments with legal nurse, critical care consulting nurses. And if you are a critical care nurse and you're looking for a career change and you want to join a very progressive, dynamic, and high-performing team of critical care nurses in the community, We're employing hundreds of years of critical care nursing experience combined, and you can join this high-performing team. If you're looking for a career change, we're currently hiring for jobs for critical care nurses in Melbourne, Sydney, Brisbane, in Albury-Wodonga, in Bendigo, in Geelong, and in Warragul, in Victoria. If you have worked in critical care nursing for a minimum of 2 years, pediatric ICU, ED, and you have already completed a postgraduate critical care nursing qualification, we will be delighted hearing from you. I do have a disclaimer though, because we are offering a tailor-made solution for our clients, which includes regular staff. Our clients also do want the same staff coming over and over again, because they are so vulnerable and so special, and that's why we need regular staff. So if you're looking for agency work where you can come and go, this will not be the right fit for you. We are looking for consistency, and our clients are looking for consistency. So please only apply with us if you can give us regular and consistent availabilities for shifts, and you're really keen on building solid relationships with us and with our clients. And if you're an intensive care specialist or an ED specialist, we also want to hear from you. We're currently expanding our medical team as well. We can also help you eliminate your bed blocks in your ICU and in your ED for your long-term patients, or for your regularly readmitting patients with our critical care nursing team at home. We're here to help you take the pressure off your ICU and ED beds, and in most cases, you won't even pay for it. Even if you do pay for it, it is so much more cost-effective than what you're paying for in ICU and ED, and you get the same level of care. If you are a hospital executive watching this and you have bed blocks in your ICU, ED, and respiratory wards, or home TPN, please reach out to us as well. We can help you eliminate your bed blocks very fast. If you're in the US or in the UK and you're watching this and you need help, we want to hear from you as well. We can help you there privately with one-on-one consulting and with hiring nurses privately. Once again, our website is intensivecarehome.com. Call us on one of the numbers on the top of our website, or simply send us an email to info@intensivecarehome.com. And if you like my videos, subscribe to my YouTube channel for regular updates for families with intensive care at home and intensive care. Click the like button, click the notification bell, share this video with your friends and families, and comment below what you want to see next, or what questions and insights you have from this video. Thank you so much for watching. This is Patrick Hutzel from intensivecarehome.com, and I will talk to you in a few days. Take care for now.